Salva Piedra. I am a psychotherapist and I'm here to help. Today we're going to be looking at how long do I need therapy for? This is a question I often get asked by clients, by parents, when they want to know how long do I need to commit to this. And this also depends on your personal circumstances. Could be financial, could be that you're a parent, you're trying to figure out all the activities, could be that you're scared, could be that you actually want to know how long you're going to be doing this. I will be asking the question myself because I want to know how long I will need. However, there are things that you need to be aware when you asking these questions. As for us as psychotherapists, it's difficult to answer the question when you have the initial assessment, the initial call. Therefore, I wanted to share this information so you can be aware of. The first thing I would recommend is for if you're a parent, do ask for the evaluation, the assessment first. Some therapists, they do 1 and 2 hours. Some therapists, like myself, we do 3 sessions, 6 sessions. I will do 6 sessions, and then I will have a proper view of what the child needs to have an understanding of how long they might need and what themes I need to work on. Once you have the assessment, then we can answer how long you need, how long we're going to recommend. Some therapists might say 6 months, some therapists might say a year, some therapists might refer you to somewhere else, to other services, other professionals where you might need to get other type of support. This also, how long you need therapy, also depends on the mental health issue you're coming with. Is it a complex mental health issue like schizophrenia, depression, anxiety? These things takes a long time, and it might need other support, other professionals like psychiatrists or other professionals that you might need to go to a psychiatric ward. It often takes a long time to treat these complex mental health issues, and it could be that you even need to take therapy for life. And that may look like 1 year you do therapy, then you take a break, or then you take another year of therapy. Yes, some of these cases might mean that you need to take therapy for life. The other aspect I also that you need to be aware of is trauma. Trauma takes time to treat, and that again depends on what kind of trauma it is, what is it that you have experienced in your childhood, how long you have this for, how long, what's the intensity, what is the trauma about. And some complex traumas can take time as well, as you need to work in the body and in the mind and changes those brain pathways, and also giving you some more resilience to deal with it. Now, that takes time, especially in children who they might not trust the therapist initially, and they need time to trust the therapist first before they open up. Some adolescents the same. It does take time for them to trust, and including adults. Also depends on the age. As I mentioned, is a child that you come in with, what is the child dealing with, what are the issues. And as I said, children take time to trust the therapist. For me, at least in my experience, at least 6 months, 6 weeks for the child to trust me and be open completely about the issues. And some kids, they might not even share, and that depending on their family dynamics. They might have the pressure of the family, they might be scared of sharing, or simply might be they're not used to talk to or asking for support. So that depends on children. They do take time to be treated. Adolescents, again, is a difficult topic. Adolescents, they might want to share the topic, they might want to talk about it, they might not. Some adolescents might want to do 3 months, and then they don't want to continue with the therapy. It really depends on the adolescent, or they might not even be ready. For adults, again, it can be difficult for adults, especially if you haven't done counseling or therapy or psychotherapy before. It can be difficult for you to go and open up to a stranger. And also depends for adults how willing you are to address your issues, how open you want to be in the sessions. Another aspect is a personal process. This, everybody has their own process, and some clients are ready to talk about. They will tell you exactly what they want to work on. Some clients, they don't even know where to start. And again, as I mentioned, how willing you are to do the process, how open you want to be. I know it can be difficult. I know it can be challenging. Some sessions can be very challenging. It's how willing you are to address those issues that you're struggling with. However, again, it depends on how much you trust the therapist and the resources that you've been given to address those traumas or those difficult experiences. That's it for now. And just remember, when you're asking this question, it's not easy for therapists to answer unless they see you first, unless they do an assessment and they see what topics you want to address. You need to consider about what mental issue you're coming with. If you don't know, it's good the therapist, the psychotherapist, or whoever mental health professional evaluates first what is it that you need to work on, what are the traumas that you want to address, what age is a child, adolescent, adults, what is your personal process, how willing you are to work on the issues, and yeah, so bear that in mind and when asking this question. And just to say, short therapy can do a bit of work. However, 12 sessions, if you're trying to sort out a complex trauma, complex mental health issue, is not going to do anything. So I would not recommend for complex mental health issues or difficult traumas that you've been through. Short-term therapy might not do all the work. That's it for now. I hope it helps. Any questions, please let me know. Subscribe to my channel. Go to my website. I got some resources there. I also offer parenting help and other bits like workshops and things like that. Any questions, please let me know. I am open and I'm here to help you. And remember that this is your process, this is your path, this is your journey. Don't compare yourself to anyone else because what works for one person might not work for you. And you need to find your own resources, you need to find your own what works for you, what is it that you need as an individual, not what other people have used. So just remember that. It's difficult, it's challenging, but get there and stay on the process. Hello.